Succinylcholine, commonly trade name for it is anectin or nectin. It is a depolarizing neuromuscular blocker, and it's also known as a paralyzing agent. Those are the classes for it. So the way it works, it mimics the action of acetylcholine on motor end plates in skeletal muscles, all that stuff, and it causes muscle relaxation and paralysis. So it produces a quote-unquote phase 1 blockade, and that is a form of depolarizing blockade. And so it depolarizes all those muscles, causes all those muscles to kind of fire off, and then it blocks any further action. So that's why you get fasciculations and almost like little muscle tremors that happen with the patient whenever you give sucks, and then it blocks any further stimulation of those motor end plates until the drug wears off. So that's what's meant by phase 1 blockade. It's depolarizing. Phase 2 blockade is a little bit different. It does have some phase 2 action, but it primarily works on the phase 1 side. Pregnancy class for it is C, and don't get too bogged down on that phase 1 blockade. I don't doubt that's going to be on any test. Indications for it is rapid sequence induction, where we need to paralyze a patient. Keep in mind, Sux is just a paralyzing agent. It does not provide any sedation, does not provide any pain management, nothing like that. All this does is relax muscles, and so therefore hopefully making passage of the tube a little bit easier. Contraindications to be mindful for: massive trauma or burns greater than 24 hours old, and the risk with that is the increased potassium that's floating around the blood and all that, and Sux will actually increase potassium even further, usually about 0.5, I think it's measured in milliequivalents per liter. It usually increases by 0.5, and so it can cause someone who's hyperkalemic to become further hyperkalemic, and that's why we want to use caution with that. Dialysis patients as well that are maybe missed dialysis or something, and their labs are all jacked up, we'll want to watch for hyperkalemia before we give Sux. Penetrating eye injury also, it can increase intraocular pressure, so we want to be mindful of that. And then a history of suspected history of malignant hyperthermia, and that's going to be a genetic trait. You might or might not know about it till after you give it, and so just something to keep in mind. Adverse reactions: apnea, bradycardia or tachycardia, hypotension, increased intraocular pressure, hyperkalemia, malignant hyperthermia, and rhabdomyolysis is all common. The apnea is definitely going to happen, and the rest of it might or might not happen. I mean, that's, if you paralyze all the respiratory muscles, you're going to get apnea. That's why we give it. Drug interactions to note: oxytocin, beta blockers, and organophosphates may potentiate the effects of it, make it last a little bit longer. And then given Valium with it may reduce the duration of the effects. Typical adult dosing, and for the kids it's the same either way. It's going to be 1 to 2 milligrams per kilogram, either IV or IO. And it starts working in about a minute. You'll see peak effects within a minute or 2, maybe 3, and then it stays working for 5 to 10 minutes. The big reason this is a popular drug in EMS is because of the short duration compared to other paralyzing agents, and so it stops working within 5 or 10 minutes and wears off, and then the patient starts breathing again on their own. So that's why we give it quite a bit. And of course, always keep in mind that you want to be sure to sedate a patient before and after paralyzing, because someone might be paralyzed but still be awake and remember those events, and that's pretty unethical to paralyze somebody without sedating them. So be heavy with the sedation anytime they're under the influence of Sux.